most important phenomenon that we're all trying to address is it's somewhat captured by what Rosalind just talked about, rising cost of healthcare, but underpinning that is the rising incidence of chronic disease and the convergence of developing markets in Asia with developed market experience in terms of the impact of those diseases. So if you look at, just take China as an example, because it's probably the purest example of a country that's sort of largely as a mass transformed in the space of 30 years. You have rising obesity because of diet, because of changes in lifestyle. You have diabetes, type 2 diabetes, both pre-diabetic and diabetic, is pretty much exactly the same ratio in the population as it is in the United States, amazingly. You have, of course, you have the residue of behaviors that are more peculiar to this part of the world. Over 50% of males still smoke in China. And so at a global level, China is lung cancer central. There's no doubt about that whatsoever. But the incidence of other cancers is exactly parallel to what we see elsewhere in the world. As are the consequences of obesity and smoking in heart disease or other cardiovascular conditions. So, and of course, you've got an aging population that's compounding this set of issues, and rising health costs, even if everything else was staying still. So these things compound to create really a major set of challenges. This is a major set of challenges in every market in the world. It's at an unprecedented scale in China, and it's I think now at an unprecedented level of urgency, because particularly in China, I don't think there is anybody in the Chinese health system that would argue that China is adequately prepared to deal with the challenge that it faces over the next 10, 20 years. And there's no possible way they can afford to do it. Healthcare is costing about $700 per capita in China. As we know, in the United States, that number is $11,000. And in the case of most developed economies in the world, the US is a kind of somewhat unique outlier. In most developed economies in the world, it's costing $3,500 to $5,000 US per capita. So any way you look at it, China's looking at a 5x, and that's in today's dollars. That will be subject to further increase in inflation. So China's going to have to find smart pathways to evolve its health system. And I think the biggest challenge for anybody taking a long-term view is just how will the alignment between government policy, market infrastructure, the private payer system, the private healthcare provider system, how will all of these pieces align, and how will they be overlaid by smart technology, whether it's at the telemedicine kind of triage and primary care delivery level, whether it's at the data infrastructure level to be able to consolidate health information along the lines that Rosalind was talking about at a national level, so that providers can actually look longitudinally at individual patients and populations, that payers can do the same thing, and patients themselves can benefit from the wealth of data that does exist, that is just simply not organized well and consolidated. So I think that there's a lot of questions in all of that, health change within health systems is, it's one of the most intractable challenges that every market around the world faces, and the Asian markets are no exception. And I think probably China is the most significant of those, and faces one of the biggest challenges.